The Secretary General of the Kenya Medical Practitioners and Dentists Union, Dr. Oluga, is now with us from outside the Kenyatta National Hospital. Dr. Oluga, what do you think will happen to the patients in the hospital behind you if you go on strike?
Larry, thank you very much for that question. Thank you for that question, because every time we seek for our rights as doctors, the question always comes, what will happen to patients? And for sure, we want to sympathize a lot with the public. We have always bore the burden of healthcare without reaping the benefits. And the doctors, just like the patients, have been the victims of a healthcare system that do not respond to their needs, because the issue that is going on currently is that for the last 3 years, we've been engaged in a collective bargaining agreement process, which was signed on the 27th of June, 2013, duly by the government. And we have been engaged diplomatically, dialoguing, waiting for the law to be on our side, waiting for the government to respond, waiting for even the government to fulfill their manifesto of increasing pay for doctors. They are doing other things, but the thing that they are not doing is to look at the issues of the doctors. Yesterday, the Salaries and Remuneration Commission released a report that they called the Job Evaluation Report. Every time we engage the employer, they always keep telling us that they are waiting for this report. They are waiting for the Job Evaluation Report. They are waiting for what SRC will talk about on the issues of doctors' pay. So far, we already agreed in 2013 what doctors need as pay. We have waited for 3 years for the Salaries and Remuneration Commission
Dr. Oluga,
to give those guidelines, to give those advice, to give the exact figures of what a doctor needs.
Yeah, Dr. Oluga, if you allow me to interrupt.
This CBA was signed by the Minister of Health. They did not fulfill it. So we sued the government as a union, the Kenya Medical Practitioners, Pharmacists and Dentists Union.
Dr. Oluga, now the report has come out. However, you've given the government 21 days before you actually go on strike to implement the CBA. SRC says they will not implement the new pay structure until next July. So what does that mean for you?
Well, you know, we have waited for 3 years already. So I can tell you that if there are people who have already waited, it's the doctors. So we have suffered sacrificially. For us, we want our pay. We want our pay now because the job evaluation exercise is done.
Do you think that
what we are telling the public
is
that the public should join
attainable,
us?
Though, Dr.
The
Oluga?
government has demonstrated time and time again that healthcare is not an essential service to them. You have seen even the same patients that you are talking about sleeping in hostels here, you know, sleeping, out in the cold because they do not have hostels when they come for chemotherapy.
Let me jump in right here, Dr. Oluga, because you say you want your pay right now. You say you want your pay right now, Dr. Oluga. Listen in for a moment. Do you think the government can afford the 300% pay increase you want?
Pardon?
Can the government afford that 300% increase you want?
The government can afford it, and this is the point. The government can treat this strike notice as a tender because they pay tenders within hours. Let them pay doctors within hours. On the 5th of December, all doctors in this country will be on strike because we have waited for 3 years for the Salaries and Remuneration Commission to give that advice, to give the exact figure. The court already gave a judgment on the 6th of October that the CBA needs to be implemented. It is affordable. It will cost less than 8 billion Kenya shillings a year. We have been talking about billions and billions of shillings that have disappeared in the health sector. The government can afford this, and let them treat this as a tender because they can do it within 21 days.
All right, we'll leave it there just for the moment. Dr. Oluga, Secretary General of KMPDU, with us outside the Kenyatta National Hospital, which was important for us to set it there because it's the country's biggest referral hospital, and there are lots of patients there that stand to lose if they in fact went on strike on 5th December.
Absolutely.